The MSc Occupational Therapy pre-registration course is a 2-year accelerated programme, and because of that it's 3 years put into 2 years, so it's a fairly intense programme. Being at master's level, it's also quite challenging. However, the problem-based learning curriculum does make this a very enjoyable experience, because students learn through a variety of scenarios, so they can have real resonance when the students go out on their practice placements, of which we have 4. One of our placements is a 10-week placement right at the very end of the course. And this offers some students to be able to go into international destinations to complete their placement. The course also involves an end-of-course conference where students get to showcase their research that they carry out. I'm very proud to be a course leader of this programme, because most of our graduates tend to get jobs within the first 3 months of graduating, which in this climate is an incredibly important employability factor. Also, in addition to this, the students go on to work in not just the NHS and statutory services, but increasingly in a wider range of settings. And this is probably as a result of the role emerging practice placement, which is where students go into a setting where there's no occupational therapist and look to see if occupational therapy could make the difference. And this has been considered through our research as being a particularly good selling point for when students go out to interview, hence the employability factor. Recently, we managed to get over 55% graduating with merit or higher. The attrition rate in terms of how many students who start the course end the course, we have 100% finishing the course, which is probably as a result of having quite a high tutor to student ratio.